you often will see on social media or whatever, like that there are places of disagreement, but there's actually a lot of consensus underneath the surface, and that's what I search for. And I went to North Carolina specifically because I was interested in working in a place that was politically divided. I worked for a Democratic governor, but we had a super majority of Republicans in the legislature. And it was a pretty weak executive branch, which means I couldn't do my work without the legislature. And so really prioritize relationship building there, finding the consensus. One of the first things we worked on in North Carolina was the opioid crisis, because that's what I heard. I said, what are you worried about? And they're like, my niece died of an overdose. My friend's son died of an overdose. I was like, we got to work on this together. And we started there. And we showed that we could work together across the aisle on something. And then it allowed us to work on the next hard thing, which was transforming the Medicaid program. And then it was implementing healthy opportunities. And then it was addressing COVID, right? So by the time we got to COVID, I had 3 years of relationship building, of trust building, of showing that I was a good listener, of trying to, find those consensus points so that when we got into COVID, we had relationships that were built, but that I really focused on transparency.